the job title and job categorization that I previously mentioned. So this brings us on to some of the recommendations that can come out of the study. So first of all, regardless of whether LUPM causes sickness absence or mortality or any health outcomes, this can pertain to the general cohort, is that those individuals with pre-existing medical conditions can perhaps bring it up with their OH practitioners to come up with some type of accommodations that perhaps might lower their exposure overall. But it also brings into light how useful routinely collected data can be, and if there are any measures that can be taken at TfL or other organizations overall to increase the usefulness of routinely collected data in terms of how specific they are. So in future, if there were retrospective analyses to be done, perhaps it is more informative and useful. We can also think about doing health surveys with targeted recruitment strategies. So this is something that TfL has started offering, where they're coming up with kind of more kind of qualitative surveys that look at stress and smoking and alcohol usage. But these are kind of on a volunteer basis, and people who want to take these health surveys can. So generally the results you see are from the worried well, and perhaps there needs to be a better kind of recruitment strategy that means that the health surveys and the results are more representative of the general TfL population. And in terms of this, there are a lot of members of TfL, a lot of employees who are safety critical, so drivers and some station staff and engineers as well, take on an annual health check where it's mostly focused on their sight and auditory health. But perhaps if you increase those annual health surveys to take into account more general health outcomes such as blood pressure or lung function, that would also be quite indicative towards their general health in the long run. And finally, we're suggesting some prospective studies to better understand how the body responds to breathing tunnel dust. So panel studies or even cohort studies to try and determine if there are any biological effects that might not result in health outcomes, but can be kind of underlying that we don't detect in these epidemiological studies. So just to summarize this kind of project, this was some of the largest health studies conducted on the subway cohort, and the first kind of cohort study to be done on the LU population. And there's a lot of heterogeneity in terms of staff PM exposure, even amongst the same job group, or even amongst the same location. And we saw that TfL staff who were exposed to higher concentrations of LUPM were more likely to report higher rates of sickness absences and are at higher risks of mortality. But there isn't enough evidence at the moment to suggest that subway PM is the main contributing factor to sickness absence or mortality. And there were quite a few limitations in our studies, in particular the long-term mortality study. So thank you very much for listening, and I'm happy to take any questions now.
Thank you very much, Justie. That was a really fascinating and interesting presentation, so thank you. I'll open it up for questions now. Era.
Thanks, that was a fantastic presentation. Well done, a really interesting study. So I've got a couple of questions, Justie. Do you have any information at all about where the drivers in particular eat their food? Because one of the often overlooked aspects of occupational exposure is ingestion. It's a good example of that is for lead workers. So I just wondered whether you had any information at all where they took their meal breaks rather, not just lunch.
Yeah, thanks. So they generally they have canteens and cafeterias and kind of mess halls in the depots that the workers are stationed at. So the depots are kind of attached to the tube stations and where they get on and off tubes. So the concentration, based on the measurements we took, it did look like they were kind of elevated, but for the purpose of the study, we excluded their meal break period from the kind of exposure measurements so that we could kind of just look at occupational exposure.
Okay, so I'm sorry, I probably didn't phrase that very well. So I'm thinking about particulate matter that they might have on their hands that they ingest. So just thinking about your all-cause mortality and your cancers in particular. Yeah, so if they go into well, first of all, if the drivers are sitting eating in their cab, they might be snacking on things and having particulate matter on their hands, which they ingest, or going to the canteen and just not washing their hands. So I guess that's what I was just wondering whether you had any information on that.
No, I don't think they're allowed to eat while they're driving, but
Okay.
I guess it's quite hard to truly know.
Okay. Okay. And a second question, if I may, just very quickly. Prospectively, I understand all this is historical data and it's fantastic analyses, well done. But so prospectively, are there any moves by London Underground to do any personal monitoring and biological monitoring of their staff, particularly their drivers?
Not at the moment. So they do annual measurements for PM concentration, but
Of where?
So they do personal samples for the drivers, and then they've got 10 stations where they take measurements on the platforms as well. But I'm not aware of kind of within TfL whether they have their own plans to do biological monitoring. I suspect not due to budget restraints, but that's perhaps something we want to suggest to them.
Yeah. And personalized monitoring as well. Okay, thanks ever so much. That's great.
Thank you.
Interesting.
Thanks, Sarah. We have a question, hand up from Maudlin, I think you pronounced the name.
Hi, it's Maudrian.
Maudrian. Hi, Maudrian.
Hi. Thank you, Justie. That was actually very, very interesting. And I love how you've put your photos in to make it a little bit more practical. There was a comment that you made that some of the stations have been closed since, years ago. And I was just wondering, because you also show a picture of the tunnel dusters. And I'm not sure, are they still tunnel dusting now, or have they gone past those practices? Have you seen any significant changes that might reduce, because we know that there is some pollution, and the way how the train lines used to run several years ago is not how it's being run now. And TfL has made some changes. Do you see any significant difference between the way how it used to run then and the dusters to how it is now, and a reduction in terms of the pollution? Or is it that because we have more people now using the underground and more trains running at a more frequent time, that actually it has increased, it hasn't decreased whatsoever? Have you seen?
Thanks for your question. So yeah, I guess so compared to the 60s, the pollution has decreased significantly, and I think that's mainly due to differences in how the brakes are run, how the brakes work. So that significantly has reduced concentration of dust. But it's really hard to kind of, on an overall basis, reduce concentrations. I think the most practical method would be upgrading the fleets for the trains. But that's really expensive, really costly, and it's not an easy change to make. In terms of cleaning, so they used to have people without PPE kind of cleaning the tunnels, as you saw in the pictures. So that's kind of different now. They do sometimes still have cleaners down there, but they've tried to trial a cleaning train that would collect the dust. I think it ran for a year in the London Underground, and then they kind of scrapped it because I don't think it's that effective, and it's also really expensive to run. So studies done in Canada that looked at kind of cleaning trains showed that kind of the day or the week after the cleaning's been done, concentrations of PM decrease, but after a month, they have elevated back to their original concentrations. So it's not a very effective measure. And it's quite hard to kind of ventilate the tunnels because there's so much infrastructure in place already in London above the tunnels. So that's quite challenging. And I guess one of the challenges that within the London Underground is that we don't know kind of the proportion that is resuspended old dust and how much is constantly being kind of regenerated. So that is a question that we're trying to kind of understand through aging the dust and looking at kind of oxidative potential.
And maybe a little bit of a follow-up. Would you consider maybe doing random tests on passengers who use the underground on a regular basis as maybe a plan B for the study?
Yeah, so there's been a study funded by the MRC, and I think a paper might be out or in process that looks at COPD passengers versus healthy passengers that traveled on the Bakerloo line and alternatively traveled on the overground. And they looked at lung function as well as kind of different biological outcomes. So that kind of gives more of a perspective in terms of both exposure and health for the general population.
Thank you so much. Thank you.
Thanks, Justie. We have a question in the chat box from Paul. Can you say anything in particular about pneumonia, given all the iron?
Yeah, so I think one of the major concerns, especially with the sickness absence study, was respiratory infections. And I think that's an area that we might be interested in focusing more on. But I don't think the rates of pneumonia in particular were kind of particular concern compared to other causes of sickness absence as well.
Okay. Bridget.
Hi, thank you for a really interesting talk. Am I correct in thinking that in both of the studies you kind of used the worker's specific job in different ways as the kind of measure of their exposure?
Yeah, so in the sickness absence, we had more detail in terms of what they did. So we looked at their job location, their job title, as well as the job location, especially for the customer service staff that I didn't present in this presentation, but we looked at which stations they worked at because that kind of had a big influence on their exposure as well. And in terms of the mortality study, we didn't have their exact job title, but we knew kind of what organization within TfL that they worked in. So that was what we used as a proxy for exposure.
Yeah, so I was, excuse me, I was thinking, like, obviously you had to work with the data that was available, but there could, of course, be like many kind of systematic differences between people working on different lines or in different jobs. So I was wondering kind of what would be maybe your top two like alternate explanations other than like PM exposure, or if you'd thought about that.
Yeah, I think probably one would be smoking status. And I don't know how different that is across the different job categories. And that would have changed significantly between like kind of historical smoking proportion and kind of more modern day smoking. But I think that would definitely be one of the kind of key covariates that we'd want more access to, especially for the mortality data, because we did specific analysis on lung cancer and we saw that that was significantly associated with kind of their job categories, but that could also be because of smoking. So I think that's kind of the main explanatory variable. And I think there's a lot of kind of between the different job groups, there are a lot of cultural and kind of different habits in terms of taking sick leave. So perhaps that could also be, that's kind of hard to quantify though in an analysis, but that would be something that would be interesting to look at.
Yeah, really interesting. Thank you.
Thanks.
Thanks, Bridget. Thanks, Justie. Any final questions or comments? Justie, I had one question I was interested in. You mentioned in terms of the organisational policies around trying to support staff around minimizing their exposure. And you mentioned something about a 1 hour maximum time period working on the platforms. Were there any other policy requirements that TfL have in place to minimize exposure for staff that you're aware of?
Not that I'm aware of.
Okay.
I think during COVID, people wore face masks, and that perhaps could have been taken forward in terms of, but that's a personal choice, and I think that would have been quite hard to police.
Yeah.
Yeah. But
Okay.
I think Joe might know, but there are and I've spoken to people where there are instances of people being moved from high polluted stations to less polluted stations, if they had things like asthma and they brought it up with their OH practitioner.
Thank you.
So,
And we'll just take one final, sorry, was someone going to jump in then? I said, we have a comment in the chat box. In terms of recommendations, any suggestions from the literature on how other countries are managing such exposures? So just thinking about the international context.
yeah, there are a lot of kind of, if you look internationally, there are different policies. So in Seoul, South Korea, there are actually kind of legal limits for indoor air pollution, and they have kind of measurements being taken in real time at every single platform. And there's actually an online map that you can look at where you click on each station and it shows you the PM concentrations. And they have also started implementing this in Paris. In places like Barcelona, I think they've got kind of they've incorporated machine learning into some of their vent systems. So once it crosses a certain concentration, there's a different kind of ventilation pattern that might increase ventilation to try and lower concentrations of PM on the platforms. And in Seoul, again, they have kind of filtration devices, I think, on all the platforms to attempt to lower PM concentrations. So those are definitely possibilities. And there are things like platform screen doors that you see on the plastic ones that you see on some of the Jubilee line and on the Elizabeth line, which traps the particles inside the tunnel. So it lowers concentration on the kind of platforms, but it does mean it can increase concentration of particles inside the train. So that's kind of a catch-22. So that's debatable in terms of how well that works, but there are definitely measures that can be taken.
Thank you very much, Justie. Well, we shall bring this month's session to a close. Justie, thank you once again for coming along and presenting your research to the wider group. And the next session will run on the 18th of July, and we will be hearing from Stefania D'Angelo from the University of Southampton, who will be presenting some qualitative research, specifically looking at the timing of middle-aged people retiring during the first lockdown in the UK. So I hope many, if not all of you, are able to join that session. So thank you once again, Justie, and nice to see many of you on the screen today. Thank you.
Thank you. Bye.
Bye-bye.